Hi, I'm Steve Olmos. My practice is limited to the treatment of craniofacial pain and sleep disordered breathing. The craniofacial pain is all-inclusive with temporomandibular disorders, primary headaches, different types of neuralgias. Sleep disordered breathing is inclusive of obstructive sleep apnea. Our center here in San Diego is called the TMJ and Sleep Therapy Center. It is one of a number of centers that I've created across the United States, Canada, and New Zealand, and also at the University of Tennessee, the Craniofacial Pain Center that is located there at the dental school. What I'd like to share with you today is the history, my history of laser therapy, actually photobiomodulation. Early on, I started using infrared many years ago, evolved to different laser systems, both the combination of infrared and single wavelengths to dual wavelengths that were not synchronized, to the point where I'm happy to share with you today the MFI and MFI5 systems, which are utilizing two different wavelengths, and the combined synergy of the two is magnified because they are synchronized, and this is unique. I have had many years of experience using these products and treating many thousands of patients, and I can tell you that I'm really impressed with the speed at which we can provide therapy. The efficacy is very dramatic, and I think that the greater surface area that these delivery systems have are far superior to anything I've used before. We are able to treat all different types of neuritis and neuralgias, from burning mouth syndrome to trigeminal neuralgias to Bell's palsy. So we've had good success with many different types of disorders, inclusive of the inflammatory problems of the jaw, facial muscles, neck, and associated structures. I hope you'll enjoy this video, and please contact us for further information. I'm going to be going over my protocols that I've developed using this product and have had good success. Thank you. Okay, let's get started reviewing the mechanisms of forward head posture and the resultant muscle spasms or trigger points that we'll be treating. Normally, there is a curvature to the cervical spine, a lordosis, if you will, that is contoured such that the head can be centered over the rest of the body. When we have problems with inflammation of the jaw or blocked nasal breathing, then the body has to compensate, and as it does, the head will sublux, that is, the cranium will slide over C1, and the resultant vertebrae will now be in a more forward position. So this is called forward head posture, or kyphosis, when the neck is in a reverse curvature. What it does is it puts undue pressures on the nerves, which then become inflamed, and we develop neuritis and different kinds of brachial plexus problems. And of course, the muscles that insert into these structures at the base of the skull and the spine now become inflamed. The resultant symptoms of trigger points with referral pain patterns then produce aches and pains in remote places and different referral patterns. These are the mechanisms by which we treat craniofacial pain, TM disorders. So inflammation of the jaw and or problems of obstructed nasal breathing will both result in forward head posture. Trigger points are muscle spasms that involve two parts of the nervous system. That is, the muscle spasm itself is being held in place by the somatic part of the central nervous system. The peripheral nervous system, in combination with the brain stem, results from these kinds of changes in brain chemistry
to have referral patterns. This can only be utilized by the autonomic nervous system. So a trigger point uses both somatic and autonomic nervous systems and is unique and different than a muscle spasm. The forward head postures that are produced with patients who have inflammation of their jaw joints or blocked nasal breathing causes elongation of the extensor muscles that insert at the base of the skull, like the trapezius, splenius capitis, and others. As a result of these forward head postures, you will see referral patterns to the jaw, the back of the head, forehead, and eye. The counter to these extensor muscles are the sternocleidomastoid or SCMs. And the SCMs have their own referral patterns all the way from the sternum up to the mastoid where they insert into. So depending on where we get a trigger point, we will have referral patterns to the throat, the chin, behind the ear, the top of the head, in the facial area, around and above the eye, and the eye itself. And you'll notice that these examples become more prevalent, and even ear pain can be the result of these kinds of problems. So we have structural problems to the jaw, we have muscular problems from these kinds of contraction issues, and injuries to the spine because of the forward head posture. These all result in different types of therapy. The laser has quickly replaced and is my primary method for treating patients with these kinds of disorders. And we will now show you these techniques. I'd like to demonstrate the protocols for this MLS system. You will be, when you purchase the system and with this video, you'll be getting this card system which will outline my protocols for jaw joint, craniofacial pain, and you can see that we have diagrams here. There'll be examples of how to use the wands and how to move them for the cervical and trapezius extensor muscles at the base of the skull, as well as the SCMs, the counters, and the referral patterns. I will also have intraoral component, and these will all be summarized in these tables and settings. So I'd like to demonstrate and show you exactly how to go about setting these things up. With your MLS purchase and the MPI system with the wand, then this is the chart that you'll be getting. As you can see here, it defaults to number 1 for this wand. With the Charlie head that we use in our practice, that would be channel 2. Okay, so in setting this up, let's refer back to the 1 for the MPI system. MPI 5 is the Charlie head, that you will default to this page here. So we will place personal, and these are the protocols that we will be sharing with you. TMJ capsulitis, masseter, C-spine with the trapezius, trigger point, trigeminal neuralgia, lingual neuralgia, temporal tendinitis are the presets that we'll be covering today. All right, let's talk about precautions. The first precaution is eyewear. So we want to make sure that the goggles are used by everyone in the room and that the room is closed to traffic from any other persons observing. Pretty much very few contraindications to using this kind of therapy. Pregnancy, electrical devices, cardiac pacemakers, cochlear implants, anything within your field that could be affected would be a contraindication. Other than that, there's a few problems that will arise. The only other problem will be metallic objects, jewelry. So we're always going to ask the patient to remove all jewelry before producing this therapy. All right, our first exposure will be our TMJ capsulitis and masseter inflammation. So we'll pick that off of our personal, press enter, and now this will be set at 350 hertz for 3 minutes at 50%. And this will give you the joule setting right here at the bottom. These are the specifications that I use for treating capsulitis and masseter inflammation myositis. All right, we'd like to demonstrate how to use the MPI system for the jaw capsulitis. We'll be doing this with the mouth open and the mouth closed, and also the masseter muscles. And certainly we'd be doing this bilaterally. So we turn on the unit. Okay, and it is not activated till we press this button here. The patient needs to have the mouth open so we can get the posterior retrodiscal space. So we're going to ask the patient to open and just rest the teeth on that in a comfortable position, and we can begin the process. With the wand, MPI system, the wand, this needs to be in motion. So we are just passing the wand, lightly touching the tissue, because this is the optimal focal distance. And this way we get a greater surface area. One of the advantages of using this system as opposed to a single point is that we can get a much greater surface area. So indeed we are treating the posterior joint space, the lateral ligaments, and a bit of the temporal tendon, as well as the masseter tendon, and a bit of the lateral pterygoid as well, while we're doing this process. So we will give this 30 seconds. With the mouth open, always moving back and forth. And then we will do 30 seconds, excuse me, thank you, with the mouth closed in exactly the same way. And again, another 30 seconds, more specifically working on the lateral ligaments and the synovitis, capsulitis of these structures. And so it's a very gentle motion back and forth. At the completion of 30 seconds of this lateral component, then we switch to using the masseter. And again, we're just passing up and over the superficial masseter, which runs in this direction from the maxillary zygoma down to the gonial angle, and of course the deep masseter, which is running from the temporal zygoma down to the inferior border of the mandible. So in this way, we're encompassing both heads, at least the insertion head of the deep and the superficial portion of the masseter. Superficial is what is activated for patients who are trying to maintain an airway. So this is very often the hot spot or the result of clenching due to daytime structural pain. And so we simply pass over back and forth for 30 seconds. And then we will simply move to the opposite side. All right, now we will demonstrate the cervical spine and trapezius muscle therapy from your personal charting. Now we'll bring that up. The settings will be 700 hertz. We will do this for 5 minutes at 50%. These are all now preset, and we can begin the process. To make sure that you have the hair off of the area in the cervical spine that you'll be treating, be sure to purchase some extra elastics for the hair. We carry these and just hand them to the patients and give them to them. They just take them home with the therapy or dispose of them. And in this way, we can keep the hair off of the area that we'll be treating in a very simple way. We begin with treating the cervical spine. Here's the midline spinous processes, and the first motions is an up and down motion unilaterally, and you want to spend about a minute with this movement. Previous lasers that we'd utilize that are held in a specific position often heat up the hair follicles and become painful. But using this system, we find that not to be the case because we are constantly moving this device up and down. This really increases the surface area that you can treat and minimizes the treatment time for the patient. Here I'm doing the right-hand side of the cervical spine. I would just gently be doing this for 1 minute and is in this process of just simply moving up and down and very gentle in contact, and then we would simply switch over to the left-hand side and again begin the process with simple movement. Again, we would give this therapy 1 minute. Those of you that understand and have taken my courses on motor reflex, you will find that within a minute this will clear the cervical component of your tests and thereby relaxing the muscles. So it's important to do the cervical spine first for 1 minute on each side using this MPI system first, and then moving to the shoulders to do the trapezius. This requires 1 minute and 30 seconds. Remembering that trigger points, especially the primary trigger points, are usually in the midpoint of a muscle. So understanding the insertion of the trapezius at the shoulder and also at the spine, we'd be looking in this area here to be treating and simply just going back and forth over these areas for 30 seconds after you have treated the cervical spine. And remember always to do these treatments bilaterally. Whenever we treat muscles, muscles work by counters, so that if you release one side or treat one side, you'll magnify the dysfunction on the opposite side. So it's really important when you're treating muscles to do them bilaterally. Okay? And don't be swayed by the patient who will tell you to treat the symptomatic side, because that's the compensatory side, the side that is the symptom. The opposite side is the primary side that's really producing the muscular splinting for the symptomatic side. So always do both sides. The next area that we will be demonstrating will be the trigger point. As you can see, this is preset to 10 hertz for 2 minutes. The trigger point's actually at 30 seconds, so this will give you the ability to treat 4 different trigger points. And of course you can always open the schedule back up and do it again. But this should be sufficient to do specific areas in the face and the shoulders. Muscle spasms or trigger points will usually occur in the midpoint of a muscle. So if we pick the trapezius, we'd expect areas right in here. There's many ways to be able to demonstrate these. Simple palpation with one finger will discern these kinds of inflammations. Another way, if you're still unsure, is just a kinesthetic technique where you can take a muscle that doesn't have any kind of inflammation and press on that while you ask the patient to hold their arm up like so and resist you pushing down. So in this case, this patient would have a control like so. Now you can put your finger on the muscle spasm, that trigger point that you are about to treat, and do the same test, and the kinesthetic test will clearly show you the patient will not be able to hold their arm up. So identify the trigger point that you will treat and place the unit right over in contact, and gently continue to move the wand over that area. Give that about 30 seconds. And that will start to relieve. The amount of absorption of the laser is dependent on the amount of melanin in the skin. So the darker the skin, the more absorption of the laser energy. The laser energy is absorbed in the chromatophores that occur in the melanin, the hemoglobin, and certainly the absorption of water as well. All right, now resist with all your strength. And as you can see, I can basically stand up on this now. All of her strength is restored and the muscle is relaxed. The next protocol that we'll be reviewing is trigeminal neuralgia. We set the program for 100 hertz, 2 minutes at 50% intervals. This treatment is for trigeminal neuralgia, which is an injury to the mandibular or maxillary branches of the trigeminal nerve. But this setting can also be used for injuries to the facial nerve, specifically the motor branch. So as the motor branch exits the skull in the stylomastoid foramen, comes around the styloid process, and now innervates the facial muscles right over the jaw joint, then this would be the result of your facial paralysis. So we can use this setting for that. A masseter branch of the trigeminal nerve, which is very often the trigeminal presentation, would all be uses extra-orally application. So we would use our wand setting, identify the areas that we would be treating, and simply lightly contact. This is at a much lower setting. What's important about this laser and why it's specific, lasers in themselves, because we really have no real therapy for healing broken nerves. There's many therapies for repairing and reducing inflammation, speeding healing to tissue. But when it comes to nerves, a laser is the only real therapy that we have. Acupuncture can certainly regenerate areas of energy to certain structures, but in my experience, it is only been of short-term use. Usually after a week or two, the person becomes symptomatic again. But with the lasers, there's a true healing of the nerve, and it's particularly the continuous pulse that is specific for that. So because the MLS system uses both continuous and pulsed and 2 different wavelengths, it's very specific for treating neural injuries. So in this way, I'm giving the presentation of treating a trigeminal problem, where I could also switch over and be treating facial nerve and anywhere from its point of origin. And I would use these same settings. The heads here need to be cleaned. In between, we simply use these sterile cloths here in order to accomplish that. You don't like to have anything obscuring the optics here. We find that makeup is not a real deterrent to the efficacy of the treatment, but you need to make sure that all the sensors are clean. Because this is an intraoral application, we can insert the collimator, and with simply having a disposable sleeve, we can now go intraorally, and this now system is now collimated into a fiber optic applicator that we can insert into the mouth. The next setting is for intraoral neuropathology. So I've demarcated this lingual neuralgia, but it could be for glossopharyngeal, it could be for any other structure, a neural structure inside the mouth. Very often the lingual nerves are injured through the extraction of wisdom teeth. Could be a portion of the chorda tympani that innervates the anterior lateral portion of the tongue. These settings would be used for those purposes. Very similar settings to the trigeminal neuralgia, 100 hertz, 2 minutes at 50% interval. Now we are going to talk about the temporal tendinitis setting, which is quite common with anyone who has any kind of parafunctional activity. I also use this setting, inflammatory setting, for areas of suture release, in addition to extrusion of teeth orthodontically. If you have teeth that are not moving quickly, literature shows that we can move teeth 30% faster after we use this laser treatment on them. So in this way, we're at 750 hertz, 2-minute time at 50% intervals. Basically, remember that the greater the amount of hertz, the more acute the situation is, and so you can see this is about a halfway point. The Charlie head really makes treatment for cervical and the extensor muscles in the back of the shoulders and other areas dramatically beneficial because we can treat such a larger surface area. At a specific 20-centimeter distance that is outlined by this little measuring device here, there's about, I'd say about maybe 5 inches difference from the point to the focal point here. And this gives us a very large surface area, so we can treat a good portion of the spine from many different angles simultaneously. So simply a 4-minute setting here can dramatically reduce the symptoms and allow for treatment in other areas while this is being accomplished. Trigger points for the SCMs are often necessary when we have problems with forward head posture. SCM, sternocleidomastoid muscle, is the counter to the trapezius. So these are extensors, these are flexor muscles here. So what we do when we want to treat it is have the person turn away from us, and as you can see, then the muscle becomes very evident. Okay, so depending on where the actual trigger point that we want to address. But we have to be very careful in this area because we do not want to have anything directing towards the thyroid gland. So what we have to do is take this muscle trigger point, and what we would do is kind of pull it towards us away from that, and then turning the unit on in this area and then working in this direction so that we are treating this away from the thyroid gland. So this is very important because you can stimulate a thyroid gland and therefore mimic many of the symptoms of hyperthyroid. Might be beneficial on a patient with hypo, but there are too many factors to be involved, and therefore you just want to avoid all of that.
My name is Ginger Helgeson Nielsen, and I was a former professional tennis player, ranked 30 in the world, and I had several structural injuries in which I had 2 surgeries, and the traditional way of healing from those injuries was just ice, ultrasound, anti-inflammatories, and it took a long time for the body to heal and recover, and I after recovering from those injuries and knowing how long it took to heal, and then later having Dr. Olmos treat me for some structural injuries, I was amazed at how fast the laser works on the body and penetrates, and the healing is twice as quick. So as a professional athlete, healing is what you're after, and the quicker that you can heal, the quicker you can get out there and perform and just feel better. So it's been amazing to see how fast this type of treatment works on your body. So it's been fabulous.
So Ginger, can you tell us a little bit about what it feels like, the actual therapy? Is it uncomfortable? Do you notice anything going on while you're having the therapy? You've talked about how much relief you got from it, but I think people might be interested to know from a patient's perspective exactly what it feels like.
Yeah, that was what was amazing is when I had the laser treatment, I felt absolutely no sensation on my skin from the laser, as opposed to like having, ultrasound or ice or STEM machines where you can actually feel the modality going on.
Mm-hmm.
The laser, there's no visible sensation. You can't feel anything, and it's working.
Okay. When we treat people for specific nerve injuries, one of the things that they can feel, and one of the reasons that we know the laser works, is that they'll actually get a tingling sensation in the nerves that we're trying to heal. So it's interesting that sometimes people can feel the actual laser working. It just depends on the structures that we're working on. So and sometimes that's a little bit disconcerting for the patient, but that is
Right.
actually proof and the actual therapy itself working is when we can activate the specific things that are going on. So it's really important for people to understand, how you feel from your perspective. In terms of you were talking about how quickly you rebounded. Studies show us that within a minute or so, that pain levels drop by 50%, but just by using the laser therapy. Did you notice a reduction in discomfort?
For me, with my injury, I felt the most relief after 2 treatments. When I went back to exercise, the pain was noticeably diminished. But for me, it took me about 2 treatments before I felt the effects, and then when I had continuous treatments after that, that's when I felt the most effects of the healing from the injury.
That's really interesting because literature shows is that the actual healing component really maximizes from the second treatment on. So what you're saying is exactly what are the findings of the research scientists for this particular laser system. And the recommended treatment is usually 3 to 4 times per week over a 2-week period. It's important that people have time to heal. So they will have a treatment, maybe 1 or 2 treatments, in succession. But then they need a day off, just as I'm sure you do when you're training every day, that you need a day off and for your body to heal. And the same mechanisms are into play. In regards to the frequency of treatment time, we've reviewed the different techniques for the frequencies and different settings. But the frequency at which you would treat a patient should be between 3 to 4 times per week. And then that's not in succession. It's important that you half the rest. So in other words, if you were to see the person 4 times a week, they should have a rest day after 2 days in succession. If you're going to see them 3 times a week, then 2 times have a day off before doing the third.
And you should do between 6 and 10 treatments over a 2-week period of time and then reevaluate. And this is a protocol that I would recommend.